So just already discussed panna than hydrocele. So hydrocele. So ulcers are edupanga. So hydrocele, what is hydrocele? What is the definition of hydrocele? It is the okay. So hydrocele is a collection between the two layers of the tunica vaginalis. Okay, this is called as primary vaginal hydrocele. So what are the other types of hydrocele? What are the other types of hydrocele? Sorry, infantile hydrocele, whether it is a congenital hydrocele, funicular, and your hydrocele en bisac, hydrocele of hernial sac, encysted hydrocele of cord. Okay, so for history taking, okay, history taking. So what are the histories you will ask? There is a complaints of swelling in the scrotum. Okay, so what? Then you should elaborate the swelling history. Okay, so what is the onset? Whether it is an insidious onset, which was initially smaller in size, gradually increase in size to attain the present size. Okay, whether it is associated with pain or not. So this is the history you ask. Okay, so what are the other histories you will ask in case of hydrocele? Why pain? Why history of pain is important? Why history of pain is important in hydrocele? So what complication causes pain in hydrocele? It is a pyocele. Pyocele causes pain. Okay. So then any secondary hydrocele. So secondary hydrocele due to torsion, testis or testicular trauma. This torsion testis and infection, epididymoarchitis. Your testicular tumor don't produce any pain. Okay, it is a painless condition. But this epididymoarchitis and pyocele will produce pain. Okay, then you ask history of fever also. Okay, so in hydrocele the examination part is very important. Okay, so examination, inspection, palpation. So what are the inspectory findings for hydrocele? What is the size for all swellings? You should assess the what is the size, shape, what is the size, shape, extent of the swelling, okay, surface. So in hydrocele that is very important. So what is the specific findings in case of hydrocele? In palpation. One is get above the swelling is possible, then transelimination, there is a fluctuation and transelimination. How will you do fluctuation in case of to confirm this is a hydrocele? How will you do fluctuation? You have to, patient in standing position, have to hold the root of scrotum with the thumb in front, other fingers behind, then have to press the bottom of the scrotum with the other hand. Okay, compress. You should assess there is a separation of fingers in the root of the scrotum. Okay, if this is present, the fluctuation is positive. Okay, fluctuation positive tells the content is whether it is a fluid or something else. Okay, fluid or some solid contents. Okay, so after confirming the fluid content, the fluctuation positive, you have to test for trans-elimination. Trans-elimination, how to patient in standing position, how to place the torch over the anterior aspect. Okay, so either in the anterior aspect, have to, or in the lateral aspect. Okay, you have to place the illuminoscope in the anterior aspect. Okay, you should not place the torch in the posterior aspect because this testis will hinders the transmission of light. Okay, so you have to elicit the transelimination. After confirming the transelimination, you have to confirm. Okay, transelimination tells this content, the fluid is a clear fluid. Okay, it is a clear fluid or blood or pus. Okay, if the transelimination is positive, the content is clear. Okay, so you have to tell the diagnosis. What is the diagnosis? It is a primary vaginal hydrocele of which side? Okay, so right sided primary vaginal hydrocele. That should be your diagnosis. What investigation needed for this hydrocele? Routine? Doppler pannuma. Doppler, routine Doppler not needed. Okay, ultrasound, scrotum is enough. Okay, so what is the content? What is the testis? Okay, so you have to assess this. So after confirming the diagnosis, what is the procedure you will advise for this patient? There is a Jablois procedure. Okay, what is meant by Jablois procedure? That is just a eversion of sac. Okay, so simple eversion of sac is done in routine cases. If the sac is a long-standing sac, if it is a large sac, what will you do? There is a excision and eversion of sac. Okay, excision and eversion of sac. So these two procedures usually you will do. Okay, so coming to the slides. So definition, the types: communicating, non-communicating. Communicating means it is communicating with the peritoneal cavity. So etiology you know already. So these are the clinical manifestations: swelling, pain, redness. So transillumination test, treatment. Okay, thank you.